This is Justin Veneri, Director of Communications at Capital RX. Thank you, everyone, for joining. Again, sorry about the delay there on the webinar. We really appreciate you taking your time to join our open forum on M3P, the Medicare Prescription Payment Plan. We hope you'll find this webinar helpful. We're getting so many questions from clients and prospects about the requirements and potential disruption to establish workflows as a result of this, that we thought this would be an efficient way to be helpful and actually show off some of what we're working on. So we're glad you're here. With me from Capital RX are Ryan Kelly, our co-founder and chief technology officer, and we also have Jason Barretto, vice president of government program operations. We're happy to take your questions throughout via the Q&A on the fly. And one last housekeeping item, we will be sharing the replay on the slides, so definitely keep an eye out for follow-up. That's it for me. I'll turn it over to you, Jason.
Thank you, and apologies again for the audio issues on our end. I will just jump into this. So as part of the IRA, CMS has rolled out the obligation for sponsors to implement the M3P program, and our response to the CMS requirements is bringing a full end-to-end turnkey solution for non-PBM clients, which includes program election, payment and reconciliation, CMS HPMS reports, call center support for education, election, and anything M3P, as well as the member portal and app experience. So double clicking into that and what that really means, we talk about billing and reporting. So providing members with their monthly statements, enabling them to actually use the portal or the app to download or reprint the statements, giving the sponsors the ability to see what's going on at the sponsor level as well as the member level when it comes to payments and reconciliation, having the ability to collect full, partial payments via credit card, debit card, check, ACH, through modes of digital app portal, through the telephone, as well as mail. We will provide you with pass-through HPMS reporting. We will provide any data point that we collect on your behalf, we will process and provide to you in daily files, or we also have the capability of providing you with API endpoints to get that information in real time. As part of the program, we will need data from sponsors. So to lighten the load, we will actually accept whatever files you receive today from your PBM or your processor, and whatever eligibility files you send to them, we will actually take those as is and crosswalk it on our side to minimize the need for you to create any custom files to send to us. And then all of the election requirements that are part of this program, whether it's opting in, opting out, grace period, termination, preclusion, reinstatement, all of that can be delegated to Capital RX, and we will do all of those program requirements on your behalf. And then we have a domestic call center that's it's not offshore, fully staffed with Capital RX employees, and we will provide all of the education, election, and any other thing that is required as a result of the M3P program. And with that, I will hand it off to Ryan Kelly for a demo.
Great. Thank you so much, Jason. And I'm going to go ahead and share my screen here. So I'm going to take over from you. And can I get a thumbs up if you can see the Judi member portal? Excellent. Excellent. So got to cover a couple of items here. I'm going to start on the member portal side, give a little bit of a flavor of the beneficiary experience here, because most convenient for my demo environment, the many demos that I am doing related to this offering. I have a beneficiary that is in a fully integrated offering here. So we would be, in theory, in this arrangement, the PBM that is also processing the claim. So you'll see a lot of other content that may or may not be applicable to a potential relationship with you all if you were to go with the standalone M3P solution. What I'm going to highlight kind of out of the gate is education. Education is going to be so critical for this program. I personally find the program to be confusing. I think that it is structured in a way that will be very confusing for Medicare beneficiaries as well. And so our goal is to provide the right content, the right information, the right education to those beneficiaries so that we have appropriate enrollment in the plan. So we've got some content here about who you should call, who you should contact. Of course, we are fully happy to take on that service fully delegated. That being said, I will click here into the opt-in portion of our functionality. So this is the view that a beneficiary would see if they have not yet opted in to the Medicare Prescription Payment Plan. You can see here not participating. The thing that we are really going to lead with here is an estimate of your payments as part of the plan. We feel like that's going to be one of the strongest things that we can present to beneficiaries considering enrolling in this program. So here, if your monthly out of pocket is $600, you can see a relatively steady trend here. Obviously, we're starting in April because it is, of course, April right now. Still solutioning a little bit on the date selection there and how we're presenting this table. Obviously, for the open enrollment, the annual enrollment period, we'll be displaying a slightly different version, but still playing around with some of the concepts there. If I were to change this monthly out of pocket to say $200, you could see here how the payments progress over the course of the year. Obviously, this December amount is quite high. We're looking at ways to highlight that information so that beneficiaries are aware that they may be subject at the end of the year to high costs. Even if at the outset it's only $20, it will be a significant amount of money that they are on the hook for later in the year. And obviously December, the holidays, Christmas, yada, yada. We want to make sure that they are equipped with that information to make an appropriate choice about whether or not they will actually benefit and actually be able to afford opting in to this program. We're also actively solutioning around what is the best number to present here for beneficiaries. Now, obviously, we would love to have high quality information about the beneficiary's previous claims, but of course, we may or may not be able to get a good information there. Obviously, there are significant differences between Part D in 24 and 25, and of course, beneficiaries may be changing benefits. They may be enrolling a new plan, so it's a little bit more challenging to see that play out there. So we are still solutioning on what is best, but again, we want to highlight what it's going to cost the beneficiary because we think that'll be the best way to help them understand what their payments are going to be and whether or not they'll benefit in the program. I did see a question briefly appear at some point in the chat. We'll address it now. This member portal is the same portal that serves all of our beneficiaries and all of our members today. So this is just a little bit of an enhancement to that experience there to bring M3P to them. I'm going to click opt-in here, and this will take me to the opted-in view of the screen. Now, the beneficiary that I am demoing with was already opted in to the program and has some payments that have actually occurred down here in this table, but you can see the payment setup is not complete. Beneficiaries will be able to opt into the program and then later specify their payment options. We think that this is going to be an important factor and consideration during the annual enrollment period to help get people up and running. We will, of course, handle the outreach and so on necessary to effectuate those things. We support credit and debit, ACH, and paper billing, of course. One thing that I will also note is we've opted in here in the member portal. We'll be also supporting telephonic via delegation, as well as the ability to enroll with the paper form. So all of those are going to be fully supported by us. Here, if you are opted into the program, you will see when your next payment is, and of course, what the estimated important word here, amount of that next payment is going to be. The amount that the beneficiary is responsible for will fluctuate, and sometimes significantly based on their actual out-of-pocket spending. So I want to make sure to highlight that it is just an estimate at this juncture. And again, much like just like the opt-in portion of this, where the member is deciding whether or not to participate, we want to have really good information about what that future estimate is so that we can work with the beneficiaries should they have any concerns about what those future payments are going to look like. So you can see here, this beneficiary has paid some out of pocket, and it will continue, of course, to grow over the course of the year should they trend at the same level of out-of-pocket spend for the remainder of the plan year. Excellent question. I see one from the chat from Angela. Can a member enter their own monthly OOP cost to view an updated estimated payment schedule? That, as we saw on the previous screen, is something that they can enter in, and it is something we are considering adding to this screen as well, so that the beneficiary who may have a better idea about their future spend, what they'll actually be experiencing in this table here. So excellent question there. You'll be able to set up your payment preferences. I think that these forms probably going to look very familiar to anybody who's ever bought anything online. I would say that many of today's younger Medicare beneficiaries, those who are potentially just enrolling for the first time in Part D, probably going to be familiar and comfortable with this kind of workflow. But again, we support all of the options that CMS mandates. Additionally, you'll be able in the portal to opt out of the Medicare Prescription Payment Plan should you so choose. I've got a couple of options here. I'm going to leave this field untouched for the time being. That, I would say, kind of is the M3P specific capabilities here in the member portal that I was planning to highlight today. We also, of course, as it is our member portal, we have the ability to share documents. We have a native mobile application that'll have these capabilities as well. We also support white labeling of this experience, and we have different white labeling options available. Definitely something, if you are interested in it, we can talk through in more detail. Where I'm going to go next is the administrative side of Judi, the kind of what a plan sponsor or a customer service agent, that kind of experience that they'll be seeing. And where I'm going to start first is here in the member view, but we also have some specific capabilities that we've built out around M3P in relation to payments. And there are a number of other functions within the Judi platform that will support the M3P program, including data exchange for your standard reporting, your HPMS required submissions, and the other things that we're going to produce on a regular basis on your behalf. Of course, we have some ad hoc query tool support. So if you want to look at specific payments that are outstanding, you'll be able to use our data output and reporting tool to get at some of that information. And I would say that test adjudication is going to be another key element for some of our customers who want to understand how much a particular claim is going to cost a beneficiary at the point of sale. So that being said, I'm going to jump here into the member view and bring up my beneficiary here. Probably a relatively familiar view to many people and has a lot of member information. Of course, again, fully integrated. So there are many tabs here that are not going to be potentially applicable if utilizing our M3P solution on a standalone basis. I will highlight, here on the app component that we do have the ability to emulate into the member portal so that we can see exactly what the beneficiary would be seeing in the portal and assist them that way if they are trying to enroll or opt in the app. We can definitely support them in a very clean way there. Like I mentioned earlier, this is our app that has been around for quite some time, and it has a lot of capabilities. M3P specifics for a member beneficiary. All right, we come here and land on this summary page. A lot of the same information that we're going to expose and surface in our member portal. You'll be able to manage the customer service agent or people working for customer service at a plan sponsor. Will be able to come in, see the screen, leverage the screen to manage participation. They'll be able to view what the next monthly payment is going to be, again, estimated, and when that payment will occur. You can see here the balance that the beneficiary is carrying. So they've paid 115, they've spent 834 out of pocket, and then the difference there is 719. So we'll be, of course, responsible for paying that additional amount over the course of the year. And of course, the plan sponsor will be able to see where this beneficiary is in relation to that. Payment schedule looks just like the one found in the member portal. So you'll be able to see the payments that have been actually made, in addition to future estimated payments based on the beneficiary's spending trends and how that grows over time, just like we saw in the member portal. For payment history, you'll be able to see specifically which payments have been created and potentially are in the process of being billed or collected from the beneficiary. If I click into here, we will be taken to our M3P Payments module, where we'll be able to see more information about individual payments. I'm actually going to click first into the payment estimator. This payment estimator, again, just like we saw in the member portal, customer service representatives will be able to use this to support beneficiaries. I see that there's a question in the chat, and I also see that Jason is typing out a response, so I will let Jason get to that. I'm going to click here, again, back to payment history. We're going to jump into the M3P Payments module. So here you'll be able to see all of the details about a specific payment, when it was created, what time period it's for, whether or not it is paid, the amount that has been paid. We've, of course, heard a bunch of feedback as part of this process that some beneficiaries are even interested in paying an additional amount of money up front. And so looking to support all of those different use cases here through the payments module. Down here, of course, audit log. So we can see every change that is made to this record. If any edits are made, additional audit log entries will appear. For payments are going to be run on a regular basis. And so we'll be creating these payment runs so that we can actually schedule when those payments are supposed to go out or be collected from the beneficiary's bank account or credit or debit card. These are just aggregating together, of course, the individual payments. So for plan sponsors that are accessing the portal directly, you'll be able to see all of the payments, all of the statuses. You'll be able to search for them here, view individual details. Again, in our data output and reporting tool, you'll be able to query those more ad hoc. And of course, with our data exchange module, we'll be setting up integrated solutions for data reporting needs that really are whatever your business is going to require. We are also contemplating canned reports as part of the program here. Still kind of early stages on these kind of canned reports that we'd like to surface. Here, I've got an example delinquent report. Payments outstanding, payments not yet made. I think that's probably going to be the most interesting kind of report to be looking at on a regular basis. So that's something that will be coming as part of the solution. And lastly, a dashboard so that you can get a high-level view of where you are in terms of what has been paid, what has been billed, what is outstanding for a long time, so on and so forth, and the ability to slice and dice this data a little bit so that you can get a high-level feel for where you are and how things are operating. So that being said, these are kind of the core, more M3P focused capabilities that I've just gone through today. I could certainly go to some other areas of the Judi application to talk about how those are going to be supporting M3P in the program. But I think what is probably good kind of at this juncture is to see, Justin, do we have any questions? Is there anything that we would like to discuss?
As of this moment, Jason answered the last question in the chat. And just in case anybody didn't see that, it was, can you see the claims associated with the balance? And that was correct. You'll see that in the M3P associated claims. We don't have any others, but feel free to keep them in. And if you want to keep rolling with the demo, Ryan, I think it'd be great.
Yeah, sure.
And I'll add 2 points. One is, so all the claims that we receive from the clients in association with the M3P program will be displayed in the user interface here in Judi. You'll be able to see them and have the ability to correlate the claim to the payment. And then we'll also, as part of our financial services workflow, to try and mitigate any bad debt for future years, systemically will be automatically precluding members based on CMS guidelines in order to lock them out of re-enrolling in the M3P program in future years. And so through that process, if they do want to be reinstated, it will have to bring their account up to date and then submit a formal request for reinstatement. CMS currently has 6 reasons why you can reinstate. One of the options is the sponsor's discretion. So we can work with you to put parameters around what your discretion looks like. Or if you want to make, you don't want to delegate that, you want to handle all reinstatements, we can do that as well. There's a lot of flexibility in how we're building this program.
Yeah, one of the other things that I'll highlight as well is obviously we are a processor of Medicare claims today, and so we are very familiar with CMS and working with CMS and have passed CMS audits and are, we have a good relationship with I believe the team over at CMS that we work with. So, those kinds of things that CMS expects and requires, I think we're in a much better position than some of the other solutions in the marketplace. Many of the other solutions that we have heard about, they're really more consumer focused, trying to pivot more into this space and don't necessarily have that working experience that we do with CMS and with Medicare. And, compliance really for us does come top of mind. So we're very sensitive to those concerns. And of course, we have a deep bench of Medicare experts along with, Jason is not just the only guy. We've got his whole team, many people on my team that support the program and support the success there. And I think that that's an important differentiator to highlight as part of our offering versus some of the other ones that are available in the marketplace.
Yeah, that's a good point, Ryan. I think, for our prospective clients, it's good for you guys to understand that we will be with you if you are selected for a CMS audit. And so that is part of the service that we are offering is riding shotgun with you as you go through the audit and ensuring that you successfully go through the audit. And so just want to make sure that that's clear, that that's part of the offering as well.
I don't think I have anything else to demo that I can fit in the remaining 2 minutes. But I did just want to take the opportunity to, of course, thank everybody that took the time to attend our webinar here. Of course, if you do have any questions about the offering, about the program, please feel free to reach out to the team. If you would love a demo, I will appear again and I will give as many demos as you would like. I love to talk about the technology. I love to talk about the product. Won't speak on Jason's behalf. I know he loves Medicare, but how much time he wants to spend speaking about it in demos, I do not know. But again, thank you, everyone. Thank you, everyone, for taking the time to attend. And please do reach out if you have any other questions.
Thank you all. And before we wrap, Jason, if you have a second, just one question on pricing, and then to get in touch, what's the best way for someone to get in touch? We will send the slides around with contact info, but is there anything else you'd suggest?
Yeah, so pricing is available. We do, you can get in touch with me directly, or you can reach out to our team via our website, and information will be routed to me. And yeah, we can discuss further the M3P program that we're bringing to market.
Excellent. All right. Thank you so much, everyone, for joining us today, and we'll keep an eye out for the follow-up over email.
Thanks, everyone.
Thank you.